I see dreams, and for me, I wanted to become a medical doctor from I was 6 years old. My dream was to become a doctor and drive a red Benz. It's no time for the Benz, you know. If somebody were to come to me right now, well, we just have to see where it goes. But right now, I'm free, single, and recently. You know, you realize that someone realized that they are dying, and you know they're looking you in the eye, and you're just trying. You're trying your best to help them, but at the same time, you can see where the prognosis is going. And yeah, that was a rough one for me. We're all here to get the job done, and the job is to get the patients better and out to the hospital. So I view it as everybody plays their part. Patient gets better, they get to go home, and it becomes a good day to work at the hospital.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels, and in office with me today is Dr. Simit, who is a medical intern in Jamaica. Welcome to the show.
Thank you, Dr. Samuels.
Right, so I'm just going to give a brief overview about medical internship, and then I get into a discussion with Dr. Simit, medical intern life in Jamaica. So a medical intern is a 1 year period after graduation when the doctor normally rotates through 4 different specialties. So they normally rotate through the general surgery, also rotate to general medicine, as well as pediatrics and gynecology, obstetrics and gynecology. However, sometimes if you're at a type A hospital, such as KPH or UWI, the intern might rotate to a subspecialty such as ENT or neurosurgery or urology. I remember, sir, correct? Right? Now, in the internship year, the intern is not able to sign his or her own prescription, so the prescription needs to be countersigned by a medical officer, a resident, or a consultant, right? And they are basically being supervised to whenever they examine or take history from patients. So normally a resident or medical officer or consultant will review their work before. Normally in Jamaica, the interns are the primary persons that do like the blood cultures, urine culture, take bloods from patients, do blood transfusion, and the general work which pertaining to patient care they will also do. In some hospitals, they will give some medications such as ceftriaxone, antibiotics, and also are basically the ones that do the preparation for ward rounds, etc. Alright? But internship is normally a hectic period, I must say, that because they're basically the ones on the ground and they have to, normally are the last to leave most of the times, and because sometimes sighting access, taking blood can really take a toll on them and take a life. And for example, what in Jamaica we have what we call emergency duty. Some interns do every 3 to 4 days. They have to basically do 24-hour shifts, and they are still expected to come in the morning for ward rounds post duty. And some interns will get day off here and there, but however, some hospitals, for example, if they're understaffed, the interns might even work up to 7 days per week. All right, so it's a difficult period, but with the right guidance and the right attitude, it's a manageable process. So once more, Dr. Simit, welcome. All right?
Thank you for having me.
All right, good. So what's internship like so far? Brief overview.
Well, I started my internship program in September. I started really 1 month behind the rest of my colleagues. So far it's been almost 4 months. It has been a great experience to date. It's just that the workload, of course, it's a lot changing from the student and having the free will to leave as you please, to know being locked in and tied that you have to stay until the work gets done. And I know it's a part of the job. But of course, when you just starting out and you realize how much more you can no longer say, "Oh, I'm going to call you doctor for you," because I'm the doctor now.
Okay.
But it's been a good experience, been a great learning experience. I must say I have been blessed to have wonderful teams to work with who have helped me along the way, who have been able to answer my questions and have not made me feel shy or afraid of having questions. Because of course we're here to learn, as you rightly said.
Yes.
We're being everything that we do is
Supervised,
being supervised, and so it's good when you're able to say, all right, I'm not fully sure what am I supposed to do right here, and you don't feel that your supervisors are going to, make you feel bad for not knowing.
Okay.
I really appreciate that.
All right. So, what was your first day like in an intern? Were you on duty, etc.? What was the first day like?
Well, my very first day, man, I was supposed to be the Sunday. That was the first day of September this year. But they had called me and said, "Oh, it didn't make any sense to come in on the Monday." So Monday morning, I got up and I got dressed and I got to the hospital early. And just taking in everything, all the I'm Dr. Smith, and actually using the title for the first time, it was surreal.
Okay.
I got on the ward maybe by around midday. By that time the ward rounds had ended and everything, because we had to go through the paperwork at the HR table. So by the time I reached over there, I never really got to see a lot of the team. But the one person I saw one of my colleagues.
Okay.
And one of the junior medical officers, and they were able to carry me through what would be expected of me. I started on urology. Urology, greatest every time, 10 out of 10. And that team, as we continue that day, they just showed me around the place, so I told me what's expected of me. I went to the clinic and it was, wow, this is what I'm going to be doing. And it was good. It was a good day.
All right. So in terms of say started, so basically you would have do 6 weeks of urology and 6 weeks of general surgery.
Yes, that's correct.
So in terms of urology now, what was some of your responsibilities while you were on urology for that 6 weeks?
Okay,
Some of the
so
stuff that you did.
well, if you have any patients that are on continuous bladder irrigation, and they're on your firm, the onus would be on you to ensure that one, it is set up correctly and that patient just came in. If you are the person who was on call that night, while the patient is admitted, once you are on call, if there's anybody that has a blocked catheter, so that basically if they're in clot retention, so the clots are not passing through as it ought to, and so that might cause the bladder to become distended, and the patient will come and say they're in a lot of pain. The nurses would call you and say, "Okay, doc, there's a patient on such and such bed, blocked catheter." Maybe they would have tried to release the catheter themselves and it wasn't working, and so they call you to step in and flush the catheter. That sometimes can be a very tedious task, because they have a lot of our patients who have prostate cancer or bladder cancer, and so they have a lot of clots, and so it's not just a 120 ml syringe flush and go. You're there sometimes for 30 minutes, sometimes an hour. But the relief is when your patient can say, "Yes, doc, we're all right now. We can get some sleep in the night now because you were able to help that situation." Other things that we do, the catheter change clinic. So as the intern or whoever is the most junior, whoever is available on the team at that time, you're just in charge of passing the new catheters.
Yes.
For the patients. And apart from that, you see your patients on a regular basis with the team. You ensure, as you said, that everything is ready for ward rounds in the morning. You collect your labs, you do the blood, we get blood transfusion set up, and that's about it.
Okay. So what are some of the other cases that you saw in urology apart from the hematuria with the bladder irrigation? What are some other cases that you would have seen in urology service?
So persons that had renal cell carcinoma, another the thing is that most of the common things tend to be common, so that's really what you're presented with. But the renal cell carcinoma cases were ones that stood out for me.
Okay.
Apart from the, of course, bladder cancers and the prostate
Big
cancers.
cancers. All right.
Yeah.
So were you able to assist with any surgical procedure? You didn't go to TOL and urology service.
In all honesty, I never went. At that time, it wasn't really something. Urology as a specialty was not something I was very interested in for myself. So I more like to do the ward work, and I would study some urology while I was there just to ensure that I was able to understand what the lingo and be able to do my best as the intern on the team. But when it came to the operating room, that's where I kind of tapped out.
Okay. All right. So we can move over to general surgery. 6 weeks on general surgery. Because general surgery is normally a
High energy. Yes.
rotation. All right. So luckily I got 6 weeks of it.
Yes,
all right?
yes.
Now, what was life like on general surgery in terms of ward rounds?
Exactly as you said, it was high energy. It was always moving, always getting stuff done, always following up something. But those 6 weeks were great. My team, it was like a family, and I must say I had that same experience on urology. And when I came over into general surgery, I was surrounded by a family of not only my fellow co-interns, but my residents and chiefs and consultants. So you come on and you realize that, okay, urology was relatively fast paced because at that time we had a lot of patients who, we call it the gross hematuria. Their HB was around 5 and 4, so you always had to be getting blood, always transfusion. And then you come over to Gen Surg and you still doing transfusion, and you following up cultures, and you're doing all your mini debridement, and you're doing your suturing.
Amputation.
And, oh boy, those are all the things I had enjoyed from medical school. Coming and being the person to do the whole thing and not just, observing on the sidelines. It was a change, but I enjoyed it. And the better I got at it, and it was a really joyous occasion, and being able to now teach the students that were coming in.
Okay.
It's like a full circle moment for me. I really enjoyed my general surgery rotation. No, I did not spend a lot of time in the operating room. I was more like get the stuff for the operating room and ensure that everybody on the ward was okay. But when it came to minor procedures, that's really where.
So I can tell the viewers what are some of the minor procedures that they did on the ward.
Yeah, so we were saying amputations, debridements of where there were ulcers or an infected diabetic foot. I did sutures, assisted with chest tube insertions and removals.
Okay.
Those are the main things, really.
Okay. All right. And so, did you get a chance to assist in the operating theater any at all?
No.
No. They only had the med school experience for the operating room.
Yeah.
All right. What about some of the cases, like some of the gunshot to the abdomen?
Right.
Prep those patients for surgery. Like we have to resuscitate them with IV fluid,
Right.
access, etc. What was the experience like with those cases?
Most of those cases, you're coming into accident and emergency, and they're doing rapid fire, getting everything ready. One that really stood out for me was where one of my residents would have called me and said, we need to get as much blood as possible for this patient. This patient had come in with multiple gunshot wounds to the abdomen. And it was to a point where we had even tried to get, he had signed for permission for him to receive whole blood because he had lost such a large blood volume already.
Okay.
When he came in. So, that night we were over blood bank and trying again and having to plead the case as to why my patient needed as much blood as possible. Unfortunately, in the end, the patient had demised, but just the adrenaline of getting, I think I had gotten 4 to 5 units that night. I pleaded for my patient and it worked out, but as fate would have it, he did not make it. But just the whole, oh my gosh, we're getting things. Or another case, we had a patient that came in from a motor vehicle accident. So he had come in slightly confused. He had broken his femur, I believe. So we were down in A&E or trying to fixate and to get the slab on at least until he can go over to orthopedic ward, and just trying to be a reassuring voice to the patient. He's asking what's going on, and you don't want to frighten him as to, this is how your bones are right now, but you just try to keep them calm and do what you have to do and take off your bloods even though they're so scared. So it's been an interesting experience. Even in the accident and emergency, my residents were still willing to teach me whether it was about ankle brachial index and the importance of that, especially with orthopedics, and how we're going to try and salvage a wound or a bone, the bones or the entire limb. It was a good learning experience.
Okay. And so surgery, what time did you have ward rounds?
So on urology we had 7:30 ward rounds almost every morning, and at first it was a bit much to adjust to, but I got on the train really fast, and I was there you had to be there for 7 o'clock to get ready. So you head up the dockets, you enter, you collected all the labs. And here at our hospital, the lab line on a daily basis in the morning is so long, and you can only have 2 persons in the lab at any one time. So you have to try and come even before 7 o'clock so you can collect your labs to get your stuff ready. But when I went on to general surgery, the time would vary based on what the day's schedule would be. So on a clinic day or a surgery day, the ward rounds normally we start by 7. Those days you might even start at 6:30 in the morning. But for me, I preferred the early start because once you got the to-do list set up early, you were able just to power through it, and that could hopefully lead to an earlier leaving time.
Okay. All right. And so in terms of some other stuff to do with internship, like food.
Okay.
How do you manage to find time to sleep and time to eat, etc., especially when you're on duty?
Well, I am truly grateful for the hospital that I chose to do my internship at here, in the Kingston region. At Kingston Public Hospital now, they provide the meals for us during the day. You're provided breakfast and lunch, and then when you're on duty, you have supper. And I really think that, especially in the area where we don't really have a lot of food options outside, you'd have to be ordering, for delivery and stuff. So I really appreciate that.
The final word about the surgery rotation, because I have to move over into medicine.
For me, I've always loved surgery as a rotation, even from medical school days. So just having done that first, it was also my first clinical rotation as a medical student. So it was just so wonderful. I really enjoyed those 3 months, and man, 10 out of 10 would definitely recommend it. Yes.
Okay, all right, good. All right, now we'll move on to medics, because they're in a medicine rotation, all right?
Yes.
All right, what's medicine rotation like?
Oh boy. It's been an interesting experience so far. I haven't done one full month, so I don't really want to give any end all and be all reviews. Workload increases because of the amount of the patient load that we have here. Like on our ward, you have 40 to 50 patients, and fine, all of them may need lab, but you have these patients plus persons who are coming in on an admission night. So it's a lot, but it's not bad.
Okay. So what are some of the cases that you can remember in medicine rotation thus far? If you have about 20 to 37 patients on each admission, you must be seeing every medical case so far.
Okay, most of our patients are coming in for the same thing. As you know, in Jamaica right now, we have the epidemic of our what they would call the non-communicable diseases. So you have a lot of patients who are coming in with complications of diabetes and hypertension. So I remember one duty we had about 10 or so stroke patients coming in that night. You have to quite frequently you'll have a patient with diabetic ketoacidosis. They may not be coming in comatose state, but they're coming in at a HI level of glucose, or is it in the 20s, and you're doing the titrations and you're bringing them back down to normal. We've had a few hypertensive emergencies and urgencies. What else have I remembered so far? A lot of patients coming with symptomatic anemia, whether it was for a rectal bleed, or if they're having an upper GI bleed. So those are the main things I've seen so far. It's just that what patients coming tend to be the same things over and over again. Sometimes, unfortunately, even the same patients coming in for the same thing over and over again. So that's what I've been seeing so far.
So in terms of your medicine rotation so far compared to surgical rotation, which do you prefer and why?
Oh boy, I don't know if it's going to be a biased answer because of always do surgery. So of course I choose the surgery rotation over the medicine rotation so far, but it's something you have to get. So I don't really want to see it as something to compare when they're really two different worlds. So I just try to appreciate the medicine rotation as it goes, but surgery will always have my heart.
All right. So we can just say some general stuff from probably other interns other students that might so graduate, like what are some of the coping strategies that they use to manage such a hectic job? Because they're basically here every day.
Every day.
And every 3 to 4 days you're here 24 hours. What are some of the coping strategies you have in terms of to have a balanced life, like to still socialize with family and friends, etc.?
Well, in my case, I'm truly grateful for family support. When I was even thinking about where I was going to do internship, I really took that as a huge factor as to where I want to do my internship, because I didn't want to be in a case where I was all alone when I'm just starting, because I knew it was going to be a whole lot. So apart from having family support or even just having good friend support, because I know some persons are here from overseas, they don't have their families here, but when you can have a good group of friends, it makes you can sit down over the doctor's closet and you sit down and chat with your friends, and you laugh about something, or you just say you had an issue on the ward and you guys can just talk about it and they just blow off some steam and run two jokes. That helps. For me, I like to try and get some rest. And I like going out with my family. I haven't really been able to do that much because, as we say, we work every day. But if it's even to go home and catch up, or maybe go for some ice cream, because I like ice cream, something like that. Sometimes I indulge in a little retail therapy. It's nice to see the fruits of your labor. You're working hard. Buy something nice for yourself. Of course, everything in moderation. For me, there are things that I knew that once I started to work, I wanted to start getting in place. So starting to work and being able to get it in place has really been something that made the work feel worthwhile for me. And so, and you still have to take time out for yourself. So for me, whether that's doing getting my hair done, or doing my nails, or doing a facial, something that you can just have if it's even a few hours just to sleep and have somebody just maybe give you a massage and you just rest. I think that's good. Yeah.
Alright, so some interns they normally have the option to go to UA or KPH, or some interns go to the peripheral hospitals. What was your reason for choosing KPH?
I was saying earlier, family support was a big one for me. When I was a student, I rotated at Mandeville Regional, and I loved it there. I love the people. I love the environment. Manitoba on the whole was just a wonderful city, and I enjoyed my time there. So it was a top contender for me. However, I did not have any family in Manitoba.
Okay.
So I would have been, and when I was a student there, finding you're all alone and you're independent and you're enjoying yourself. But for a whole year, I know it would have been, of course, a growth experience, and of course, you open up your mindset to being self-sufficient and getting your stuff done by yourself. But I wasn't sure that I was ready for 100% independence. Just starting into a very tedious job, so that was maybe number one. And as a student, I also enjoyed being at KP. I just found it exciting. I found the patients hilarious. The people in general, you're going to have a few people that want to maybe do the most, and of course you're going to have difficult personalities everywhere you go. But I just found it as the place to work. I thought it was a fun place to work as a student, so I looked forward to coming back here.
Okay. All right. Now, as an intern, you're always rank medical set of medical doctors, right? Mm-hmm. And then you have the interaction with the nurses, porters, physiotherapists, etc. So, what's the interaction with the nurses like on the different rotations so far?
Well, when I just started out, I remember my first duty. So it's your first week of work, and you're being called and asked, "Doc, what am I supposed to do?" And I mean, for some, you know a little thing, so you can kind of figure out, or maybe based on your judgment, this is the best thing to do. But for me, I've always asked nurses who I can clearly see who have been in the job far longer than I am.
Yes.
What do you normally do for this situation?
Okay.
Right? Because I'm just starting out. These ladies, most of them have been doing this 5-10 years. They are seasoned, they know what to do. And so I'm not afraid to ask for help. I'm not afraid to ask for, okay, nurse, what would you do in this situation? Most of the times we end up lining up along the same thing that I was planning to do. But it's just nice to, still engage them in the thinking process. Yes, it's ultimately your decision. But I tend to do that. And if I still have any doubts or concerns, of course, I always contact my senior. But for the most part, the nurses I have dealt with have been good. Haven't really had much issues with anyone.
Oh.
And I am grateful for that.
So some of the other supporting staff, such as the PC, janitors, porters, what are interactions with those?
I'm not sure. Some people say sometimes because of my personality, I tend to get on with people well. But at the end of the day, we're all one team. And, sometimes when you speak with some of the patients, I remember this patient saying he didn't want a nurse to put up something for him. He wanted it to be a doctor. And I said, well, if the nurse can't do it for you, the doctor won't do it either, because we're all one team. And so if it is a case where you can't respect the other persons on your team just because they're not in the same level, then you yourself are not ready to be a part of the team. Right? So I just try to treat everyone with respect. We're all here to get the job done, and the job is to get the patients better and out to the hospital. So I view it as everybody plays their part, patient gets better, they get to go home, and it becomes a good day to work at the hospital.
Okay. Now, just tell us what have been the worst day for your internship so far? What had happened that day? You don't mind.
I think maybe when I was on urology, I was on call one night and we had a patient that was on call that weekend, because on subspecialty you do Saturday, Sunday if you're on for the weekend, that's what you mean. So I was on the Saturday and Sunday. The Saturday we had notion that this patient she had recently done surgery and she was starting, surgery has lots of complications. So we realized that perhaps she was developing one of those. We were trying to treat that, and then by the second day, she was crashing, and you're there and you're doing CPR, and people, CPR takes a whole lot.
Okay.
It takes a whole lot out of you. And yeah, if you thought you were fit, the CPR showed that you're very unfit. So I think that was one of those days for me. You realize that someone realized that they are dying,
Okay.
and they're looking you in the eye, and you're trying your best to help them, but at the same time you can see where the prognosis is going. And yeah, that was a rough one for me. And we as a team, we had just debriefed and discussed it. But yeah, have I had many days like that? Not really. And sometimes on medicine, where we have way more people that were pronouncing, and like I remember one duty, the first as I came on the ward, that was the first thing I was told to do. And so it's just like, man,
Welcome to medicine.
welcome to medicine. And I'm just taking it as it comes. I think this job has helped me even more, and some family situations that I've had this year, just to appreciate life more, and to stop putting things off. I think very frequently we say we have time, and you realize you really don't. And so I've been trying to be more intentional about how I go about life because of the work so far.
Okay. All right. So this program we normally talk about life, sickness, and death, and I'm very inquisitive in private life as well. So do you have,
Oh my
have a partner?
No, I don't.
You're not ready for one, or you don't have the time, the chance.
Well, I wouldn't say it's not that I don't have the chance, but whatever the Lord has in store for me, just I'll leave it at. Okay, I don't say, if somebody were to come to me right now, well, we just have to see where it goes. But right now, I'm free, single, and disengaged.
All right. And all right. So any final words for the viewers, because I know it's late.
What would I say to medical students who are watching this? You can do hard things. Medical school at the time, that was the hardest period of my life. There were moments I was wondering if this is really what I wanted to do, if I was going to finish this school thing, if it made sense. And I'm glad I persevered. It wasn't of my own strength. The Lord carried me through for sure. There were many times when I was like, yeah man, I'm just gonna tap out. And by the grace of God and my parents, my mother's prayers, and my aunts, they really carried me through. To fellow interns who are doing internship, we can do hard things. We have made it through 5 years of medical school, and I mean sometimes the days get really rough.
Okay.
But we can make it through. We've been doing it so far, and the Lord is well able to see us through. And to anybody else who's listening to the podcast, I would say to chase your dreams. And for me, I wanted to become a medical doctor from when I was 6 years old. My dream was to become a doctor and drive a red Benz. It's no time for the Benz, but everything in time. But I never stopped chasing that dream, even when I never got accepted initially. And I mean, I left high school. I still went straight into medical school, but I wasn't initially accepted. So, it was a little toss and turn. Lord, what am I gonna do?
Okay.
I've never really planned. I had backup plans, but they weren't, backup plans that I actually wanted to get done. So chase your dreams down fervently, passionately, and you can do it. And with God as guide, just continue to strive for the best, and He will continue to lead you and direct you once you put all your trust in Him.
All right. Dr. Smith, well said. So, as before, I'm grateful for you to take this time out of a busy schedule to come on my program to talk about the internship journey so far. I hope persons listening to this podcast would have learned some stuff and is inspired by it, right? And remember, guys, to share, like, subscribe, and leave a comment on this video. And tune in next time for more informative content and more informative medical content and life, sickness, and death. Take care.
All right. Thanks for having me.
Yeah, okay.
All right.
Be sure to subscribe for more informative contents on life, sickness, and death.